Hello, hello, hello. Let's talk about your health. So, I've been talking about this metabolic health test that we do. It's one of the easiest ways to find out, are you having candida? Are you having adrenal fatigue? Are you having a thyroid problem? Let me make sure I explain this. Because so many women I meet get a thyroid panel and they're like, I'm normal, I'm healthy, and they tell me their symptoms. They can't lose weight. They have joint pain, brain fog, like that perimenopausal. Um, those things can be helped, but what people don't realize is the thyroid panels were really made for disease, and you have all this disease before you get disease. It's one of the best tests that we've seen, and there was a medical doctor talking about this. A medical doctor treats women. The thyroid underarm test that we do, your temperature, because your thyroid helps control temperature. And so we do this test, and we have people say, "Oh yeah, my thyroid's not doing its job." And thyroid usually is, let me make sure I say this right, because the gut is really not healthy. And the gut's not doing, because hormones are really coming from the gut and how the gut is doing its job. So if the gut's not healthy, the thyroid's not going to be healthy. So we usually get the people to heal because we're working with the actual gut to get people better. Well, we do these tests because we want to see how everybody's doing. And we have multiple tests we do, but we always start with this one. I've had so many women bring in their blood test and they weren't getting better, and they were put on meds, but never getting the problem really solved, and there's no chance of getting off the meds if you don't actually fix the underlying problem. And candida is a big one. That's why it's part of our test. Simple questionnaire: fungus, parasites, mold. They all work together. So if you guys are very curious about that, because curious what everybody wants to learn about fungus and mold, because there's different ways we treat it, and especially diets. Especially if you have a lot of joint pain, if you guys have heard of oxalates, but your body can be more sensitive if you keep having constant joint pain. You'll be very sensitive, and there's certain foods like rhubarb and spinach and even vinegar can cause you to hurt more in these joints. There's people on a fungus diet too when you have a fungus problem, because of course a lot of times you crave things too when you have fungus and candida. The things are, it's feeding the monster really. Like, I know I used to eat tons of sugar when I had parasites and fungus, and my tongue used to be like super coated, like sticky white in the morning. And that's why we have what's called a spit test. I've had people so bad that their tongue is brown and purple. One person, like, I never thought I'd see that. I only used to see it in a book, learning in school. Now I've seen it in practice. But people get better when we heal the gut, like the lady I was working on today. Like, we did the gut program. Then we have to modify and tweak it a bit for her to make sure she's getting full healing, like SIBO and all these bacteria diagnoses. But really, it's the bacteria's off, and there's a reason why your body has been trying to protect itself, or things that are bad are overgrowing. So the number one thing I see is probiotics, probiotics, probiotics. That's what everybody tries, because I get it. Google and AI now will tell you to do that. And the other thing is they'll tell you to do zeolites for like a binder. Well, those have it's a form of heavy metal, and your body can react, especially if you have parasites, because your body is full of heavy metals now. And I've done hair samples, because I like hair samples better than blood tests for heavy metals. But a lot of times let's just treat it. I mean, you can spend the money on a test if you want, but I'm like, let's just work. Let's just do the treatment. And a lot of times people get better and don't need to do the full test. I've done it all myself: the hair test, the stool samples, the spit test, blood test. I did them all. And I've come to find, we do these tests first, we're probably going to help 90 to 95% of people going that route first. And what I always say is follow the horse, not the zebra, because a lot of times it is a horse. Now we start seeing the zebra, even though they sound the same, then we'll go down the zebra route. But most of the time, if we start going down the right route, we're going to get you better. The body's supposed to heal itself. Let's start there. And the thoughts you think, oh, this is huge. The thoughts you think is part of your healing process. Because if you think you're never going to heal, and you got some diagnosis, and you believe it, that's it, the rest of your life, okay, you're probably going to believe that. That happens. And I never understood how they tell people that. Because so many times I've heard stories where people get cancer. They tell them you have 3 months to live, and they live years, like 10, 20, 30 years. They don't die. So I don't know why they say that. speaking death onto you is not good for your brain. So there was a neurosurgeon I just listened to, and this is not new information. This is old information, and just I feel like when an MD who's a neurosurgeon, somebody very smart, talks about it, that must be true, even though people have been talking about it for a long time. The thoughts we think create pathways in our brain and changes the way our brain fires. And this neurosurgeon looks at functional MRIs and shows that. And I've seen the technique I do, neural emotional technique. They've had that with cancer patients, like the way they thought. And even after we did our work, I didn't personally do it, but the research they did doing the NET technique changed the way their brain was seeing the stress. And it actually was, because you can't live in healing if you can't be healing and stressed at the same time. And so getting the brain out of that stress creates a higher healing factor into your body, because you want to be in what's called parasympathetic. That's why you see a lot of people using these vagus nerve stimulators, because the vagus nerve is parasympathetic and we want to engage the parasympathetic. But if we shock the crap out of it all day, which there's times and places to stimulate it, but if you have fungus and all these other problems, the chemistry of your body is going to kick you right back out. So if you keep going back to it, there's a reason why you keep kicking it back out. And that's why I think the problem is really complicated, and why I don't want to just sell a product to people, because it's not that simple. I wish I could just say, use this one thing and you'll get better. But the body's so complicated that it's not going to work as that simple. Everybody's different. I have a bunch of different machines I've used. I have one that has the same frequency as a cat's purr, because cats don't get cancer, and it calms down and it turns on your parasympathetic. I have that hummingbird video I made. I have vagus nerve like exercises that people do. And then we also have to heal the gut. And then there's the emotional side. And so we look at all three of those majorly issues: physical, chemical, and emotional. And between all three is the nervous system. How is the nervous system reacting to the physical, chemical, and emotional? And if there's one that's winning or kicking you back out, this is why your supplements may not work, because the emotional side or the physical trauma. Because our fascia in our body holds on to emotions. And that's what people, I think, are starting to catch on to. And there's more and more and more people out there in the world, like Human Garage, doing fascia stretching and emotions. And, I'm the last guy I thought I'd be doing emotions, that's for sure. And how the body reacts. I just did it today. This person kept having like bowel hip pain, and there was an emotion tied in with that. Now, did I still check her for chemistry? Yes. Was there anything going on? Yeah. Maybe we wanted to help support the liver more. And so, because certain body parts have certain emotions, and there's ways we can test that. Do you need support for that organ because it's been under stress for so long? And that's where that comes into play. And then, my wife does amazing things with this, what I call clean keto, and it's called fast to faith, where you're reading a Bible verse every morning, and you're changing your brain into gratefulness, and that actually helps you heal. Like, that is part of the healing. It's not just her changing her diet to keto, it's actually the brain pathways of knowing you're loved and who is God and how you're important, and these Lectio Divina, as they're called, is really part of the healing process. And I tell people they should do a grateful journal and try to be grateful, because you being grateful changes their brain pathways. Not Googling everything and saying you have cancer, because that's not going to actually help you heal. And you watching the news all the time, and there's enough to be worried about. We should do exercises to be grateful. There's also a lot of good things out there. But we are wired for survival, and if you get stuck in survival, you're going to get sicker. We do know that. People that worry get more sick, and have more commonly get sick. Like this morning, I did a cold shower, which I rather do an ice bath when my ice bath is broken. And the cold shower made me feel great afterwards. Going into it, I was like, even though I've done it before, I was like, oh, good night. But controlled my breathing, was in control. My body was producing good, endorphins and dopamine afterwards. And so my body felt so good, in the inflammation and my pain from working out, my joints, because I've been rock climbing again, because I'm not a good rock climber by any means. And then my joints feel better. So all these things are important. So keep up the good fight. Let's get you back to health. If you want to work with us, 1degreefh.com, 309-698-2500. I treat people over Zoom. I do calls. We can talk and we figure things out. And on my website, there's a wellness check I have people do, and we can send you the metabolic test. God bless. Let's get you back to health.